Well, remember, COVID-19 is an infection that usually has a very long infection period. You would have noticed that the countries that have been infected thus far have gone through a long period of infection, which includes what's referred to as a surge. And during the surge period, you have high numbers of people that are infected that require medical care, etc. And therefore, you need high numbers of health professionals, particularly doctors and nurses, to respond to that. Now, so certainly in the South African context, we, even before COVID, had a limited number of health professionals to respond to such a surge. So the idea is to bring on board as much resources in terms of health professionals, including doctors and epidemiologists, etc., to respond to the surge period. So we're here largely to help us respond to that this outbreak, particularly when it gets to the surge phase.
And what expertise is amongst these medical professionals that have arrived from Cuba?
They have a range of skills. There are family practitioners, public health specialists. There are biostatisticians, epidemiologists in the group. Those are the broad categories of people.
All right. So why Cuba from all the countries in the world?
Well, the Cuban health system has probably the greatest number of doctors in the various specialty fields. They have offered a number of countries assistance. You may note that Southern European countries have used them for their outbreak, and they've been very effective there. And so we've taken advantage of the offer to bring those doctors on board to assist us as well.
Do they have experience in viral infections such as this one?
Yeah, they're fairly effective, particularly in disease outbreaks. Cuba has been very good at containing a number of infectious diseases. Their training is very much at a primary care level and understanding community-based interventions. And so we would utilize them based on their particular skills to complement what we currently have in South Africa.
All right, you talk about complementing the South African story, but it certainly has not been without its controversy. Locally saying, some doctors here saying that we didn't need the Cubans, and in fact that there are doctors here that are unemployed.
Yes, I think we need the Cubans and we need the doctors that are here. I think the point I was making earlier was that if you took all the doctors available in South Africa and mapped that against what is needed in terms of the COVID-19 response, particularly in the surge, you realize that we need many more health professionals if you want to respond effectively to this. And so for that reason, we brought on the Cubans. The Cubans don't replace the South Africans. They're there to simply complement us. They're going to go back once the COVID-19 outbreak is resolved. They're simply here to help us with that.
So are you assuring the South African medical fraternity that no one will be unemployed during the time that the Cuban doctors and medical staff will be here?
We will certainly make sure that we employ as many doctors as we can, if they're willing to obviously support us, and we will deploy them across the country as the outbreaks occur, yes.
All right, so there are estimates that this deployment is going to cost us something in the region of 400 million. Can we afford that?
Well, I'm not sure. I think the 400 million was just a preliminary costing. Remember that the doctors are probably going to be here for the period of the COVID outbreak, and I think that costing was done on a 12-month period. We're anticipating that our surge will be here around August, September, and so we hopefully wouldn't need to spend 12 months here. Right. But if we can afford it, well, I think we have to spend all of the resources we can to save as many lives as possible. So I don't think it's a financial issue at this stage. It's more an issue of what can we do to save as many lives as possible.
And where are they going to be deployed?
They're going to be deployed in all 9 provinces. All of them have provided an indication of their needs. And so each of the teams of Cuban doctors will then be allocated to each province, the way they will support the province in those areas I mentioned, family medicine, epidemiology, biostatistics, as well as public health.
How are you going to overcome the language issue?
My understanding is that I haven't spoken to them myself, but my understanding is that they're fairly conversant in English, so it wouldn't be a major problem for them. We will obviously give them an orientation in the next week or two so that they have a clear understanding of how our health system works. Some of them, I understand, have been to South Africa before. Remember, South Africa has a long relationship with the Cuban health program. It's not new. And so some of them are returning to South Africa, so they have a good understanding of our health system. But those that are new will obviously have to orientate them.
All right, and we're going to move on to the fight against COVID-19 domestically just now, but perhaps just to get some certainty, what you're saying is that these Cuban doctors are going to be an additional resource after we've exhausted all of the South African capacity, because when we surge, we just won't have enough resources as we sit on our own.
Yeah, remember, we're building field hospitals all over the place. Nazareth, in Durban, in Gauteng itself, there's several sites that are currently under construction. In KZN, there's quite a few. The same applies to the Western Cape, etc. And we need doctors, nurses, and other health professionals to man those hospitals, etc. So the resources that we have are fine for our hospitals as they sit currently, but we're going to need many more people if we get into the surge at the level that some of the mathematical models predict.
All right, let's talk about the fight against this COVID-19 pandemic. We're coming to the end of level 5 on Friday, and I'm just wondering, have we achieved what we had hoped to achieve as we get to that Friday deadline?
Yeah, I think we've done very well during the lockdown period. If we look at the number of cases that we've had since the implementation of the lockdown to now, as what we would have potentially had. So I think there's been a massive reduction. I know a few days ago when we did the analysis, we would have been about 17,500, and at that point we were only at about 4,000 cases. So there's a massive reduction in the number of cases that we would have had. And consequently, that would have resulted in many more deaths. But lockdowns in themselves will only achieve their full effect if they are over a very sustained period of time. So that will be several months. Now, no country can survive with several months of a lockdown and a marginal economic activity. So clearly we have to achieve a balance between the effect of the lockdown and economic activity. If you look at the modeling curves around future lockdowns at this stage or extension of the lockdowns, you will see that the height of the curve remains almost the same. However, the time of the peak is extended. So introducing further lockdowns in the current form will effectively push out the date of the surge, but will not necessarily reduce the height of the curve. To reduce the height, we're going to have to implement some other intensive measures, such as the one that we started already, which is the door-to-door screening and testing. The second is to implement measures such as the isolating the elderly, asking people with comorbidities to stay at home, wearing of masks, the workplace sanitation and measures to prevent infection, etc. So those are some of the additional measures that we're putting in place now, which we think will be more intensive in dealing with the infection as it occurs currently. I should say we've been continuing to screen, and our screening has increased quite significantly. And despite the increase in screening, we're still seeing more or less a 3% positivity rate, meaning that despite increases in numbers, one would anticipate that we would find more and more people that are COVID positive. But that doesn't seem to be the picture. The number seems to be fairly static at around 3% of people being COVID positive. And you'll notice that even our mortality rate is sitting between 1 and 2%, which is very much in line with the lower global average as such. Oh. I don't know if this is before the winter season starts and whether things will change, but we're hoping that this kind of trend continues.